And now for the conclusion and some additional tips. So to summarize, it's important to do a spiritual assessment on the patient at every visit. The first visit will generally be more comprehensive, but it is important to continue to touch base with your patient on each and every visit. Also, determine what symptoms or issues are present in conjunction with other observations from the team. Remember, you're part of a team, so be sure that you're touching base with other members of the team to see the types of issues and symptoms that might affect how your patient is interpreting your visit and their own spiritual life. Design a plan of action that's individualized for the patient and the family. The more specific, the better, because it assists other members of the team and perhaps a chaplain who's going to be substituting for you. We all want to go on vacation once in a while, so that way they will be able to follow the plan of care without interruption and be able to understand the specific issues and considerations that are present for the patient. Consider what interventions you will use. You'll want to look at any tools that you might need, tools and supplies, but remember, an intervention is an action item, not a tool. So again, we talked about buying a diet book might be a little bit too general for my plan of losing 5 pounds. Following the recipes for 5 days is far more specific and more of an action plan. So same thing with any of the work that we do with our patients. Also, always evaluate the effectiveness of those interventions. You may find that perhaps a book or some scripture readings that you thought would be particularly effective and helpful, and in fact the patient may even have said their favorites. But you discover when you come back to visit that they actually were distressed by the specific scripture, that they were reading it in a different way. And there might be additional types of readings or different things that will be more effective and be more helpful. So we can always evaluate and modify our plan based on those evaluations. And always review your charting to be sure that it paints a true and complete picture of the patient's condition. Sometimes it's tempting to want to put kind of the, happy, joyful, successful patient was relieved and thanked me when we want to make sure that that's actually the case and not something that we don't want to chart wishful thinking. We want to chart exactly what's happening with the patient and look for how that is consistent with the observations the other members of the healthcare team are making as well. Sometimes when reviewers or surveyors will read a chart and they look through the nurse's notes and the doctor's and the aides and the chaplain, nobody seems to be talking about the same patient. So you want to review that and make sure that you are indeed contributing to that full and complete picture. We want to paint the picture of what's going on with each individual patient. And then what comes next? Be sure to let the patient and family know when you'll return. Also, follow up with any complaints or problems with your manager, the primary nurse, or the physician. When you're talking with the patient about how are they perceiving the care that they're receiving, that's an important question to ask and important to find out if they are indeed feeling that they're being treated with dignity and respect. And you want to definitely follow up on that. Or if they complain about something completely outside of the scope of your particular visit, they might say, well, this bedside table is dirty and no one will clean it for me. Well, it's a great time to be able to talk about that, be sure that that complaint and that issue is resolved, and that the folks who need to know about it are aware. Also report any medical concerns or signs of decline to the primary nurse or to your manager. One of the things I always like to do as a hospice nurse, hospice nurse or chaplain, when I meet a patient for the first time, if they're able to shake my hand, if they're a little bit, in kind of better shape at the beginning of their time with us, to be able to shake their hand and say hello and feel the grip strength. They can have a nice, strong, firm handshake. Hey, that's great. Maybe a couple of visits later, that shaking hands feels a lot weaker. Maybe time goes on and they can't even lift their hand to shake my hand. And I have to slip my hand under theirs to show them I'm there, to give them a little squeeze. That's really important to be able to report. Make sure that the primary nurse, the physician, make sure that folks are aware of that they may have missed those signs and symptoms, to make sure that they can address that if need be. So again, especially if you're in home health or a nursing home setting, or hospice especially, be sure that you're reporting your observations during team meeting and contributing to an interdisciplinary plan of care. So some additional tips, just some fun stuff to add in here. Confidentiality, very important, and you're probably very aware of that, taking a look at the HIPAA rules. The patient need to know information. So for instance, you're part of a team, but you also, let's say that you know that your neighbor is on hospice, on your hospice service, or a relative wants to know, how are things going? Is the patient on your team? Well, if not, then getting on the computer, looking up the patient record, that's a HIPAA violation. That's really not appropriate. We only the patients that we need to know information about are ones that we should be seeking out information or learning more about that. So again, we are part of a team. Now, this can be a unique concern for patients or for chaplains and their patients, because as part of a team and being hired by, say, the hospital or the nursing home, or especially on hospice, when you are part of an interdisciplinary team, sometimes chaplains will feel that they are the pastor and the patient is their parishioner. And that's really not true, because we talked a little bit about the scope of practice. A scope of practice for a chaplain who is hired by the facility, who is part of the team, is being a team member. So again, a pastor with their parishioner may have a sense of confidentiality, that every single thing that's said to the pastor is held in confidence. That the pastor may also be more directive in the type of pastoral counseling and care that they provide. They may have specific scriptures that they have, kind of their go-to scriptures when patients express, or their parishioners express different concerns or different problems. The parishioner may indeed be asking for the pastor to tell them, what specific prayer should I be using? Should I say? How can you, or pray with me? And those types of more formulaic prayers would be certainly very appropriate and part of that pastor-parishioner relationship. Conversely, with the chaplain is there really, in a sense, to set aside, use their own faith tradition, of course, but to set aside the vocabulary and the trappings and the practices, in a sense, so that we can journey with the patient, to companion them. In a sense, have the courage to set all of those kinds of things aside, even hope, so that we can journey with the patient in a secure and stable way. They may be experiencing and really journeying through that dark night of the soul, where they're going really deep within themselves to see what is going on with them, to have that kind of depth of experience that they need. It's an important journey to take, and with help, with that companionship, they can then have that confidence that they can come out the other side, understanding themselves deeper, and we can understand ourselves deeper. So a very deep and important, profound aspect of the care that we provide is, again, part of looking at the difference in scope of practice between what a traditional pastor might provide and what a chaplain will provide. And again, please review the APC standards for this. Those will be listed underneath. You'll have access to those if you don't already. But looking at the confidentiality aspects, as part of a team, we really do need to report the different things that are going on with the patient. The patient may indeed be telling you that they feel very distressed. I won't be going to heaven because something dramatic occurred in my past. A woman may say, well, I can't go to heaven because I had an abortion when I was a young woman. This was maybe 60 years ago. And while you might not say the specific problem that the patient, the specific thing that they did, you definitely want to talk with the team and allow that report to them that the patient feels distressed, that they don't deserve to go to heaven, and they need reassurance that they are a valuable and a good person. So you may have specific interventions and suggestions for the other staff members to help reinforce that. So every member of your team has signed a confidentiality agreement there, and they're under the same confidentiality rules. So there really isn't a problem or a risk with sharing that. In fact, we need to share that so that we can be part of the team. Sometimes when chaplains hold everything that they do so close to the vest and so confidential and chart very little, the team can actually wonder what is the value of the chaplain. And a chaplain that comes into maybe comes in to relieve you for a vacation, they're going to see your patients. They won't have an idea of where to go with that. They won't know what to do for the patient, and in fact may undo some of the good work that you've been doing. So that's how the communication and sharing information can be so important. There's an article that I'll be linking to, as well as the APC standards, that will be linked at the bottom of this. So, look below. And you'll find the links to those to have more reference for that. And if you have questions about any of that, definitely leave them in the comments below, and I'll do my best to help answer those questions for you. Alrighty, how to correct an error. Well, in a computer system, some of you may have computer systems already, and it's very easy to backspace or make a change. While on paper, if you have a paper backup system, be sure that you're correcting errors correctly. To have a single line through, initial and date the change, and then if room, insert the correct information right there, or if not, place the corrected information in the next available line. And only use black ink. Don't use blue ink. Definitely don't use red. And use black ink if you're using a paper system. Also, it is never okay to use whiteout. Whatever papers that you do have to work with, definitely don't ever use whiteout. Don't try to obliterate your error with ink. We're not trying to cover up or hide our mistakes. We're simply realizing we're all human, and we're going to use a single line through and then correct that mistake. It might be we start charting on the wrong patient and saying, they love their Brussels sprouts when, Mr. Jones hates his Brussels sprouts. So whatever it is, definitely make sure that we're making that single line, that we're not trying to cover anything up as we're trying to hide our mistakes. We simply made a mistake when we fix it. So definitely, though, thank you so much for making a difference in your patients' lives. You definitely do, and I'm so proud of you for wanting to come in and learn more about how to chart on the patient, how to communicate better with your team, so that the patient can receive the very best possible care. Your contribution, as well as you in enhancing the knowledge base for your teammates, so that they can contribute to that care as well. And the patient is looked at as a whole human being with many different aspects to them, and not just a diagnosis of the gallbladder in room 3, but a whole person who has an amazing background, amazing strengths, and ways that we can contribute to their healing process. So definitely thank you again. And if you have questions, feel free to leave them in the comments below. I'll do my best to answer them. Please do be patient, though, as we swing back around to catch up on any questions that you might have. So what did you think? Leave a comment below to let me know what you thought about the presentation and any additional information that might be helpful to you. Again, links will be available at the end for different connections to APC standards, an article that I've written about confidentiality, as well as the ability, if you like, to be able to have, I'd be happy to send a certificate of completion for the presentation. So that would be available to you as well. So thank you again for your kind attention, and I hope this was helpful for you, and looking forward to seeing you next time.